And then I'll go ahead and share my screen. So hopefully, oh, I didn't share my screen. I'll go ahead and share my screen. And hopefully everyone can see the screen. Oh, I just have to, sorry, there seems to be more people in the waiting room.
Amir, do you want me to just admit the people in the waiting room, or you just?
Yes, thank you very much, Haley.
Okay, I will do that.
Okay, great. So we're going to get started. This is the last webinar in our series under the social enterprise space. And today we're going to be talking about impact measurement. So I'm going to be going over a very high level view of two of the most common ways to conduct impact measurement in the sector. So the two most common ways are called types of evaluation are theory of change and logic models. And they can look very similar. They can be used interchangeably, and they often can blend into one another, but there are some distinct differences in the way that you organize these two evaluation frameworks. And then how you use them in your work. So theory of change is probably the more complicated and an intensive evaluation model to develop. So what we have when you're looking at doing a theory of change model is you begin with a long-term outcome that you're trying to achieve. And then we do a backwards working to figure out what activities, so why we want to accomplish this long-term outcome, what activities we're going to need to accomplish that long-term outcome. And then we work backwards and look at all the necessary short and medium-term outcomes and preconditions that must be met, and all the activities that we need in order to build towards that long-term outcome. So it's a sort of a reverse process where we focus first on what the outcome we are seeking is, and then we consider all these preconditions. So that's a visual framework of how you could organize a theory of change model. A logic model has a similar format, but rather than starting with the outcome and working backwards, we start with the inputs, which lead to activities that we do, which will generate outputs and then outcomes. So it's identifying our program components, and then those lead to outcomes. So it's a forward looking evaluation model rather than a backwards looking evaluation model. So there are significant overlap between theory of change and a logic model. So both identify inputs, activities, enablers, intermediate outcomes, and impacts. And so you really just pick the one that you think is best to be used in your organization, that's the most clear for the type of outcome that you're striving to make, and the size of the project, and you know how you fit into the sector, both within your local community or maybe on a global scale. But developing these types of frameworks really helps to put names to and acknowledging all the steps that you need in order to deliver that long-term change. So they both drive to identify not just what you're doing, but why you're trying to do it and what you're trying to achieve. And this can lead to a more robust approach to, you know, how you decide to monitor and evaluate and program your activities along the way. So we're just going to look at some of the comparisons between logic models and theories of change. So they both graphically illustrate program components, but logic models, whereas they just identify outcomes and inputs and activities, the theory of change does more work to link outcomes and activities by explaining how and why the desired change is going to come about by carrying out these types of activities. So as I said, logic models usually starts with a program and illustrates its components, whereas theories of change starts with our long-term goal and then works backwards to decide what programmatic approaches are needed. Logic models identify the program requirements, but they don't always illustrate why the activities are expected to produce outcomes, whereas the theory of change is going to require you to justify quite clearly at every step how your activities and inputs are going to lead to outputs and short and long-term outcomes. Logic models don't always identify indicators. They don't identify how to measure whether outcomes are met or not, but theory of change requires those identifying indicators. So I've discussed a bit what about theory of change is, but it's a causal framework of how and why a desired change process is going to take place in a particular context. So when you go about developing a theory of change model, it's a very rigorous process where you have all your gather all your stakeholders in one room and identify what types of conditions everybody believes are required for the long-term goals to be met. So you focus first on that outcome and the long-term goal, and then work backwards to build interventions and activities necessary to get towards that. And then you have a system of built-in indicators so that you can track over time whether or not you're going to meet that long-term objective. And also importantly, it identifies explicit rationale for all preconditions that are required in order to achieve the goal. So we will talk more about the definition for those preconditions and assumptions as we go through developing a theory of change model. So this is just another way to describe theory of change. So we have this causal pathway, and basically we're going to create a set of connected building blocks on a map that will display a pathway of change. And I have coming up both a sort of generic example, like a generic framework, and then we'll go through some specific examples. And it's very important to articulate your underlying assumptions of what is going to be tested and measured. And using a theory of change model really shifts the way you think by setting that goal first and then working to achieve it rather than building your activities first and then working towards the goal. So it's that working backwards framework will put your activities and initiatives into a different perspective. So here's what we have as the theory of change model. So in the long term, so this is a general sort of overview. We're looking for some type of outcome change, either social, economic, political, or environmental. And in order to get to that long-term change, we're going to have some medium-term actions, which could be in behavior and practice, decision-making, different policies, social actions, etc. But in order to get to those medium-term actions, we're going to have to develop some short-term learning in our awareness, knowledge, attitude, skills, etc. And so how do we get to those short-term learning goals? Is we're going to have to conduct activities and create a series of outputs. So those outputs could be, publications, increased knowledge, delivering of services, having trained staff to deliver those services. You might need to create some physical products, so buildings, roads, etc. This is all very just, generic, not directly applicable to any particular organization. Our activities could include, having workshops, delivering services, developing products, networking, counseling. And then we work right back to the initial inputs that we'll need. So where do we need to invest our resources, our financial resources, our human resources to develop the staff and consultants and the materials and the equipment and the partners that will lead to then being able to deliver on these activities, create these outputs, which will generate short-term learning, leading to medium-term actions, and then finally giving us a long-term outcome that we desire. So most importantly, sort of the take-home message with theory of change is we identify that long-term outcome first, and then we're going to work backwards. And then by the time we get to the start, then we have a forward-looking model that we've generated. So another way to sort of look at this is we're going to have one sort of large overall improvement. That improvement is going to be the result of a few impact changes. That impact is going to be the result of changing the climate. That climate change is going to be the result of generating a series of outcomes that come from having inputs. And then this arrow indicates that under that umbrella, we go to our overall long-term goal. So to put this into context of a specific model, if we were looking to have our long-term goal or outcome is to improve maternal, newborn, and child health as our long-term outcome, we're going to have some type of impact on health. In order to have an impact on health, we could enhance a health service or improve individual wellness behavior. To establish that impact, we're going to have to change the climate of the demand for the services. So how are we going to improve those services? We need to improve the equity of them. We can reduce the costs of them. In order to change that demand for those services, we're going to have to generate a series of outcomes that make them more equitable and reduce social cost. So we can do that by extending the range of services, enhancing their access, improving the quality, improving the efficiency. And then what are the inputs that need to be established to go into that system's outcome? So we'll need to do some work on education and information, increasing our health workforce, providing we're going to need medicine and vaccines to be accessed. We're going to need some type of financial and social protection, someone to lead this project, and then to integrate all these services. So from these inputs, we'll then generate these system outcomes, which will then change the climate, which will then lead to the impact on health that we desire, which will then lead to our final overall long-term goal of improving maternal, newborn, and child health. So theory of change really has 6 steps that we break down. So we identify that long-term goal or goals first. We do this backwards mapping to connect all the preconditions and requirements necessary to meet that goal. We're going to identify the basic assumptions about the context we're working with, identify the interventions that our initiative will perform to create that change, determine what indicators we're going to use to measure the outcomes to assess whether or not we're on the right path to the long-term goal. And then at the end, we'll write a narrative to explain the logic of what we're doing. And that is really key, particularly for funders. If you're looking to get funding, that to showcase to people that you have a really clear understanding of a roadmap of how you're going to get to that long-term goal. So in this context, I'm just going to use an example of creating employment for domestic violence survivors. So that's the long-term goal. So you get all of your internal, external stakeholders together and agree on and get very specific about that goal. And then we'll design a simple map of the preconditions required to bring about that long-term goal. So in order to have long-term employment at a livable wage for survivors, this group would have identified 3 requirements. So survivors would have had to attain coping skills. Survivors have to have marketable skills in non-traditional jobs. And then they also have to be aware of no appropriate workplace behavior. So unlike an employment training, just sort of in a general setting where you're just going to be teaching people the skills to do a job, if you're wanting to help reintroduce domestic violence survivors into the workforce, there's some acknowledgement that they're going to need additional supports. They don't just need to acquire the skills to do the work. They're also going to need these coping skills and have appropriate workplace behavior. So that's built into the framework so that we can achieve that long-term goal. So now we're going to do our backwards mapping to tell the story that's appropriate for the purposes of planning. And our stakeholders may want to know the root causes of the problem. And this is particularly challenging because, you know, most social change programs and broad initiatives have a lot of moving parts, and you may go through many revisions when you're doing this mapping and trying to connect outcomes. And of course, you're not working in a silo. There's going to be many other organizations and the community at large who's also making contributions and trying to solve certain problems, and their work could be influencing what you do, either negatively or positively. So this can be quite challenging. So I would say the theory of change isn't necessarily a static model. You may need to make adaptations in your program as you go when you start to see some of the things that are changing in your environment, but still remaining connected to that long-term outcome. So now we're just going to keep working backwards. So we're looking at these three things that we need in order for domestic violence survivors to attain good jobs with livable wages. So as far as coping skills go, how do they get coping skills? Well, they'll need to know where to get help and how to deal with the issues. So working back from there, we can have options for them to attend peer-to-peer counseling, as well as having, you know, crisis support available, you know, on a 24-hour basis, so that if anything comes up and that, you know, they're not able to wait till their next counseling appointment, that support is there. And then for learning the marketable skills that they need, and also knowing and having appropriate workplace behavior, they could go through internships. And in order to be successful in those internships, you want them to understand the expectations, so have training around expectations. They need to be trained in the skills. And then also the employers will need to be aware of the skills that the survivors are getting in order for them to be trained properly and have a really good fit. So for survivors to be successful in those internships, these are the key requirements that are identified. And then we get to having more successful learned skills in the workplace, as well as good appropriate behaviors. So to complete the framework, we're going to go all the way back to the initial condition. So how do women become enrolled in the program? First, they have to make sure that they're committed and available. So women with children will have to make sure that they have regular childcare so that they can commit to the program. They're ready to commit and attend. How do they get to this commitment stage? They hear about the program, and then how do they hear about the program through different social services agencies and domestic violence shelters, training, and then the program also needs to be developed and articulated. So then assumptions are the conditions that the group believes are needed for the success of the program. And we already exist and will not be problematic. So we're going to operate on some assumptions, and I'll give specific examples for this example. But these are things that you should sort of already be existing. They're not things that you're going to have to work to create. But if you aren't clear about your assumption, then it might not already exist. And if you're assuming that it's there and you work from that basis, but it's not, then the program could be at risk. So if they're incorrect, they can completely alter how the program works. And so for me, I think it's best to illustrate this with an example in this context. But before we do that, there's 3 important types of assumptions to consider, which is the assertion about how the connections between all of the outcomes rely on assumptions. We want to substantiate that all the important preconditions have been identified, and then we want to justify the links between the activities and the outcomes. But these are all required in order to reach that long-term outcome. So if we look at our long-term outcome of gainful employment at livable wages, we assume that there are jobs available in non-traditional skills for women. So this particular program was looking at women getting into the sector of construction, electrical, plumbing, carpentry, etc. So we assume those jobs are available. So without that assumption, it wouldn't be successful to train women with these skills if they're not going to end up being able to work. And in this context, you would have little to no control over that job sector. So it's outside of your program, but that assumption needs to be built in. And then as well, we have assumed that these jobs are likely to pay more livable wages, are likely to be unionized, provide job security, as well as providing women with upward mobility. So these are 2 assumptions that we've made before we even begin this program. That's outside of our program and our control, but they're critical to the success of the program. So further down to the next level of outcomes, to achieve that long-term outcome, we stated that women need to attain coping skills. So we've made an assumption that women who are survivors of domestic violence need more than just skills. They also need to be emotionally ready for work. We've made an assumption around the outcome that survivors will have marketable skills in non-traditional jobs. We assume that women can learn these non-traditional skills and be competitive in the marketplace. And so then we're going to do a series of interventions or activities that are going to bring about these outcomes. So people can use the term strategy or activity to make up what these interventions, to describe what all of these interventions are. So attending peer-to-peer counseling is one activity that will be needed. One of the things that needs to happen in order for the program to be successful. And then the activities around that peer-to-peer counseling would be whatever's necessary to make it happen. So finding the space, the time, the counselors, deciding if it's going to be a group format, individual sessions, combination of both. So you'll need to identify all of these activities for everything you need to accomplish those short-term outcomes, building the blocks on the way to the long-term outcome. And then to determine whether or not the initiative has been effective, we're going to collect data for each different outcome to determine what isn't and what isn't happening, and then figure out why. And so each indicator is composed of the population, the target, the threshold, and a timeline. So the population is the whole group that you're measuring. And then the target is a subset of that population. So how many of that population you're going to expect to change based on your initiative. And then the threshold is a minimum outcome. So how good is good enough? So if, what is your level of success achievement look like? You're not going to be able to service the entire population likely. And then your target is sort of, your ultimate sort of dream of how many people you'll be able to service, but likely within that target, not everyone will be successful in getting all the way through the program for any number of reasons. And so what's the threshold in your organization's mind? That's that minimum. And then your timeline is when does this outcome need to be reached? And so then you look at different indicators. So who is the population you're targeting? That's the women enrolled in the program. How many do we expect to succeed? Perhaps we're looking at 90% of the enrolled women. What's the threshold? So once they've completed the program, you have some sort of target of how many people completed it. And then what did they achieve at the end? Is a $12 an hour job good for at least 6 months? This is probably from an older example, because I don't think a $12 an hour job is looks that great anymore in the context that we're in. But and then when does this outcome need to happen? So how long after graduating from this program would you expect women to find gainful long-term employment at a decent salary? So then we have all of these outcomes. We're going to look at indicators for each one. So our long-term outcome of employment at a livable wage for domestic violence survivors is an indicator of employment. The population are all the people who have successfully made it through the program. And then in this case, they determine the threshold is following graduation, they hold a job for at least 6 months and earn at least $12 an hour. Outcome 2 was the development of marketable skills in these non-traditional jobs. So the indicator is developing a skill in some type of construction work. Again, our population is the people who participated in the program. And then the threshold is completing the internship. So the outcome 1, you can see that's the long-term overarching outcome, and the population there is program graduates. But outcome 2 are all the people that participated in the program. So they might not make it all the way to graduation, but they have completed the successful part of the internship piece anyway. So they do have these skills, which is a necessary outcome to build towards outcome 1. Another level 2 outcome, or another part of outcome 2, having the marketable skills, is then looking at whether or not they graduate. So there can be 2 separate threshold indicators involving the same outcome and the same participants, and looking at why some people were able to complete the internship, and then why some people get all the way through to graduation. So we're getting pretty granular when separating out these indicators. And then for training in non-traditional skills, an indicator would be attending all of the training sessions. The population, again, is program participants. And then you'd have some sort of threshold. So if you offered X number of classes, you would want there to be an absenteeism of women missing no more than 3 classes. And that could be the threshold that you've set that ensures that they've attained these non-traditional skills. And then once you have all your building blocks in your theory of change, you're going to write a narrative that summarizes the major elements of it, where you go on to provide the evidence on the problem analysis, what assumptions you've made, what rationales you've made, and how those all relate to the long-term goal and outcomes, and the pathways and interventions along the way. And as I mentioned, the theory of change is a dynamic model. So you've made assumptions that are being tested along the way with the implementation. So you just need to be monitoring that theory of change model and updating it when necessary, because there might be internal changes in your own organization that could affect how this long-term outcome is going to be achieved. And then, of course, in the wider context of society, there could be lots of changes going on that could impact the assumptions you've made, that you've built your long-term outcome on. So it's by no means a static, I sort of think of it as a business plan almost, which is by no means a static document, because you're constantly having to update it according to the changing landscape of the world we're in. And so once you've completed it, though, you have this clear testable hypothesis. You have a nice visual representation of the change that you want to see and how you expect it to come about. You have a blueprint of how you're going to evaluate these indicators and how you're going to measure success. You've sat down with your stakeholders and gone through this process together. So everybody who's involved in the project has a very clear picture of what success looks like and how you're going to get there. And then you have a really powerful communication tool. So if you have a very complex initiative and you're trying to explain it to other stakeholders or funders or staff, you have this really great visual tool where you've taken something that could be very complex and you've broken it down into these clearly linked outcomes leading to your long-term goal and all of the activities and inputs that you need to get you there. And then you can use this to check milestones and make sure that you're staying on track, to document any lessons that you've learned. The evaluation will be very transparent because everybody's aware of the theory of change model. And then you can use this to create reports later on for funders, policymakers, and your board. So that is a very broad overview of theory of change, and there's lots more that goes into it. There's entire courses that you can do in it, so it's just a very high level overview of it. And now we're going to shift and talk about logic models, which I said have a very similar sort of graphical representation, but how we build them is different in the sense that rather than starting with our long-term goal and working backwards, we start with our inputs and activities, and we go in the forwards direction by determining what outputs are going to be generated from those inputs and activities, and then what intermediate and long-term outcomes will result. So to develop a logic model, you still need to be aware of what your program will be addressing. So you can ask yourself questions about the need of this program. How can you document the need? What type of data you're going to use? How big is the problem? So specific numbers. Who are you trying to impact? So you're looking at your target population. And then is it reasonable? Is the program reasonable when you're considering the need? And then other things you might want to consider is who's going to be using the logic model, who should be involved in helping make it. So similarly to the theory of change, you want to involve as many stakeholders as you can. And then are there any other organizations who are also addressing the need that your program is targeting? So for your inputs, we're looking at what the organization is investing in the program. So this is your money, staff, volunteers, equipment, etc. From those inputs, you're going to determine what activities you're able to execute on. So that could be tutoring, teaching financial literacy, serving meals, etc. And then the outputs are the direct results of the program activities. So I'll just spend a bit of time. So in logic models, you have to really be very specific about what your outputs are and keep them distinct from your outcomes. So the outputs are what you do. So these are like more measurement data in terms of numbers. So, you know, how many seminars you held, how many youths were matched with a mentor, how many meals were served. It's very hard data. And then the outcomes are the benefits realized or the change. And so that's where you're trying to ask the question of, did this program make a difference? So was there a change in behavior, a change in skills, a change in attitude? So when you're doing your outputs measurements, that's generally very easy because it's just a basic counting exercise. But when you're trying to measure outcomes, that can be a bit more challenging to determine if, how do you measure a change in behavior? How do you measure a change in attitude? So you want to think about asking the right questions in the context so that you are ready to determine how you're going to look at those outcomes down the road. So as I said, outputs are what you do, and outcomes are the change in the population. So I just have some examples to illustrate the difference between outputs and outcomes. So if we had a free medical clinic, one of the outputs might be that 50 individuals were provided with free doctor visits. And then an outcome we could measure is that as a result of that output, we've seen a 50% decrease in emergency room visits. In a math tutoring program, you could measure the number of children that receive tutoring during a school year, and then you could measure as an outcome what the results in the scores from the tests were. And then another example is youth mentoring. So an output is how many youth are matched with an adult mentor, and then an outcome you could measure is increased self-esteem as a result of the 1 year of mentoring. So when you're looking at that outcome of increased self-esteem, you would have to consider developing a questionnaire or doing an interview around how you're going to determine that outcome. How are you going to measure that self-esteem? So those are important questions to think about when measuring outcomes. Dropout prevention. So we could count how many youth at risk are receiving services to prevent dropping out. And then as a result of that, the outcome would be that 85% of the youth in the program for 1 year or longer graduate from high school. So this is an example of a logic model that was developed in Sierra Leone to work on enhancing literacy, numeracy, and other foundational skills. So a logic model starts at the beginning with inputs. And so in order to carry out this program, they needed financial resources, human resource, time, and expertise. And then from those inputs, they created a series of activities or conducted a series of activities, including fundraising, sourcing of digital media tools, curriculum development, training up teachers. They generated outputs, including videos, presentations, curriculum, lessons. And then those all led to outcomes, which in the short term was access to learning content, increased knowledge of learners' foundational and numeracy skills. And then the medium term, they continued to improve their reading and numeracy skills. This was particularly, they were interested in astronomy, so they were developing awareness, increased awareness and interest around core astronomy concepts. And then the long term, they continue to improve their learning outcomes. So unlike theory of change, which would have identified this long-term outcome and worked backwards, our logic model starts with our inputs and activities and works in the forwards direction to determine the outputs and outcomes that result. So that concludes our presentation on the two sort of most popular impact evaluation frameworks. And I've just given some resources here on theory of change and how to develop logic models. So I will thank you for your time and stop sharing my screen and see if there were any questions. There was a thank you. So before we conclude, I know it's a lot of information. And yes, the recording will be posted on our YouTube channel. But I hope that that is helpful in getting people to think about different impact evaluation tools they can use in their own organizations.
I just have a quick question, hopefully.
Sure.
So I've seen these models before, and what I can't quite figure out is how to take them from like the creation of them phase to actually using them, or to like yeah, putting them into practice, I guess. I wonder if you could.
Yeah, so I would say that I am by no means an expert in these types of model creation. So I think that if you are interested, if you want to send me an email, which I will type my email address in the chat. There are several people who do this professionally, and you will have to use. I would definitely recommend an expert to help you work through this. So we recently held an in-person seminar series, and I have a couple people in mind that you could reach out to in terms of constructing these types of models. But I definitely, it's sort of like, you know, legal advice or accounting advice. Like I would really lean on somebody who has a lot of experience doing this. So if it's something your group is interested in, I can pass on that information. And I know from other organizations, they've started writing impact evaluation as part of their funding asks. So they just build that cost, starting to build that cost right into their budgeting. So yeah, that would be, yeah, if you want to send me an email, I can put you in touch with some people that can help you with that.
So Vicky has a question. Is the theory of change model only best when you are using a highly consultative / stakeholder engagement process?
I would say yes. I would say that that model, the theory of change model, because of its complexity and all of the assumptions that need to be made, that you really want to engage as many people as you can in developing it, because there's always going to be somebody, you know, who comes at things from a different angle and maybe sees some assumptions or preconditions that people who are too, you know, deep in the weeds of a project might not. And so if you, the more stakeholders you engage, you know, will bring a lot of perspective into developing that. And you definitely don't want to overlook some of those assumptions, because you're going to be building a lot of your outcomes on them. So I would say yes. The high stakeholder engagement would be key.
I see that Natasha is raising her hand.
Yeah, this might not be fully formed. It's kind of a need or a challenge that I see maybe you could speak to is as a provider of an output. Sometimes it's really hard to have the data of the outcome, particularly like the length of projects or even knowing what data is collected like provincially that could speak to larger change. So I don't know if you've seen, that's more of a like challenge, and I think it might be with some of the experts, or if you had a thought or how you might
Yeah,
demonstrate that otherwise.
yeah, I would say it is definitely a challenge. And the other thing that people tend to do when it comes to impact evaluation, and I've seen this in some of the you know, more seasoned, you know, veterans of the art of impact evaluation have seen this, where there's a lot of backwards looking work. So the project's complete, and then you're attempting to measure outcomes and outputs after the fact and collecting the data, which is a challenge. And then I also think outcomes are tricky, not only in the fact that they're not as clear cut as outputs, but getting the data might be hard. And then it's hard to determine, because, you know, we're not working in silos. So how do you know that
Exactly, yeah.
your program was the one thing that made that outcome increased? And so what's really, when I was working with some of the people who did an impact evaluation in-person seminar, is really asking the right types of questions. So I'll just give an example. I know that different literacy groups used to ask, like, the outcome was, you know, how many kids have improved their reading, which became a very hard thing to measure because they're children, and what does that improvement look like? And then was that really the goal? So they sort of stopped asking that question, and they started asking, you know, do kids enjoy reading more? Do they feel more confident in reading? And so just shifting that outcome to something that was a little bit easier, you know, easier to measure, maybe more relevant to what they were trying to accomplish, sort of shifted how they were measuring outcomes. But from everything, all the work I've done with outputs and outcomes can be just very tricky to wrap your arms around. So I would say when you start doing your impact framework in consulting your stakeholders and perhaps bringing in someone with some impact measurement experience, trying to like clarify, making the outcomes a little bit simpler, you know, instead of trying to be like, have we, you know, change society in this massive way, try to, for a logic model anyway, you try to narrow it down a bit and make it a little bit like more concrete and a bit simpler to measure. I don't know if that answered your question or if it was a bit too rambling.
No, it's very helpful, and I kind of knew it'd be a bit of a question, but even the emergency room visits, I would see, again, like attribution, but maybe the participant, we could say, did you go to the emergency room less than the last year? So that's helpful. I guess kind of the part two, or maybe it's a need, and I don't know if CSN would be the place, but just even knowing some of the key data sources that are collected in PEI would be really helpful. So I've had, and I'll use the Alliance as a grant example to say, you know, what provincial data would you use to show that this is demonstrated? And I think for many of us that have that limited evaluation research capacity, and that would be probably multiple sources like StatsCan, or there's the well-being survey, or just even knowing what's already being collected would be a really helpful piece.
Yeah, I think that would be, I don't know, it would be data that's like would be specific to each organization,
I know,
what types of stats you're looking for. But if for your specific area of interest, if you wanted to send me an email, I can try to, you know,
amazing,
hunt down where you might look.
Yeah. Perfect. This was great.
Great, thank you.
I don't see any other question. All right. I think we can wrap up. Thank you everyone again for making the time to come here. And Amir's email is in the chat. If anyone has any question, feel free to reach out. And I wish everybody have a good rest of their day.
Thank you very much. Have a great day.